gender dysphoria, gender identity, is something that's a hot topic these days. And my perspective is that it doesn't matter. Let children be children. You know, if you're asking them over and over and over and over, and they're getting, input from, from social media, and peers and whatever, like, they're going to have to answer the question: what gender are you? What gender are you? What gender are you? No, just like, why do they have to identify? Just by being, they are. They're identifying by being. Like children, and they need time to develop into who they are and what they want to do with their life. So it's like asking a little kid to decide now what profession, what job they're going to have when they're an adult. Like my 5-year-old, being asked, what do you want to be when you grow up? And he says a policeman or a fireman, or a teacher, or a mommy, or like, it's like, this is what, they're thinking about now, but you want them to decide now? You have to decide now. No, we can't do that to our children. We have to let them develop and become who they are to become. And we want to nurture it, but the way you nurture it is not by forcing an issue. Nurturing it, you give them experiences, you give them knowledge, you try to pass on information, try to help with understanding, not by forcing them to make a decision. Because no 5-year-old, or very few 5-year-olds, if you ask them what job they're going to have when they're an adult, are they going to be right? It certainly happens, but very few. Those are extremely special individuals. So when it comes to mental health in general, it needs to be a compassionate approach, and certainly with children, we need to have a compassionate approach. So one thing we want to do, is keep the stress response lower. We know that the stress response and someone going into a post-traumatic stress response causes mental health issues itself. So you have the trauma that's an impetus in itself to cause some mental health issue. But then you have the perpetuation of the post-traumatic stress that itself allows for the development of a mental health issue. And it's Abraham Hoffer, Canadian psychiatrist, he had the perspective that psychosis is really related to the improper detoxification of adrenaline and stress hormones. So there's a buildup of chemicals from the improper detoxification that have an LSD-like byproduct that cause auditory hallucination for the most part, certainly sometimes visual. So one of the main things we want to do to protect and prevent, also treat, is keep the stress response down. People don't make good decisions when they're under major stress, when they're under under the thumb of decide this way or this way. So we have the Calm Kids formula that helps with the inhibitory neurotransmitters to help relax, anti-anxiety, anti-depression. It has phosphatidylserine in there that helps regulate the cortisol response. Other vitamins and 5-MTHF. That helps with neurotransmitter utilization and neurological detoxification. For adults, we have the mood support, we have the PTSD, anxiety ease, and then we also have the neural support that does help with neurological detoxification, which we've seen to be beneficial for long COVID. The brain fog and the fatigue, that goes along with that. So we want to be honest that kids are kids. We want to protect. We want to show compassion. We want to provide a safe environment for children to develop into a responsible, healthy individual in society that brings God-willing benefit to society, revealing of goodness and godliness into society. And we want to, we as Refuel Medicinals want to provide medicinal nutraceutical approaches to help children, to help adults, be who they are, without the spilkies, the anxiety, the trauma of trying to decide who they are and what answer are they going to give to a particular question. Let's take down the stress level a notch, and allow people to experience, open their eyes, and develop into who they are, God-willing in a healthy way, in a positive way, and revealing more goodness and godliness in the world.